Welcome to Quad A Now, where we explore the world of patient safety, the impact of accreditation, and other topics relevant to outpatient healthcare facilities and dental practices. Join us as we explore diverse topics, share success stories, and navigate the challenges that define the pursuit of excellence in patient safety.
Welcome to the Quad A Now podcast. Today, we're honored to have Dr. Michel Rouif, a leading expert in plastic, reconstructive, and aesthetic surgery from Tours, France. Qualified by the Council of the Order of Physicians since 1991, Dr. Rouif has a distinguished career and a favorable accreditation from the High Authority of Health. He holds a Doctor of Medicine degree from the Faculty of Tours and various specialized diplomas in microsurgery and legal compensation for bodily injury. Dr. Rouif's impressive career includes roles as the head of the clinic and assistant at Tours hospitals, as well as a lecturer at both the Faculty of Tours and Paris Descartes University. He has been actively involved in professional organizations, serving as the president of the French Society of Aesthetic Plastic Surgeons and the Association of Plastic Surgeons of the West. He also practices at the Paul San Leonardo da Vinci in Chambray-le-Tour. Dr. Rouif also just recently finished his term as the Global Accreditation Chair for the International Society for Aesthetic Plastic Surgery. Today, Dr. Rouif will share his insights on advancements in plastic surgery, the importance of accreditation, and the future of aesthetic procedures. We're excited to have him with us for what promises to be an enlightening discussion. Welcome, bienvenidos. We just finished up the ISEPS biannual Congress in Cartagena, Colombia. We both have just returned to our respective homes, but that's the reason for this very international welcome and international topics for today. So welcome and thank you for joining me today. So in terms of just kind of starting out for background for any patients or any other physicians who might be listening to this, I just want to kind of set the stage for your own perspective here. What inspired you to become involved with ISEPS? Can you share what's important in your perspective to the roles for international societies in the field of aesthetic plastic surgery, and why it's so important for aesthetic surgery to speak with one unified voice around the world?
I think, the involvement in ISEPS was really something for me, which makes sense in that way that, of course, we are trained in our countries, different countries, in France, for instance, for myself. But the fact to share the different way to fix and to learn also aesthetic surgery, aesthetic plastic surgery, for me it makes sense. And the second point is, I've been involved a lot in associations since maybe 30 years, and I like to have this work all together. It was in France, and then for SOFSEP, for instance, I was the president of SOFSEP, still general secretary, and makes sense to share with the other ones, and we like the international exchanges we can have. So for me it was natural to go forward, and to be involved in France, and then Europe, of course, and also ISAPS. ISAPS is really the way to be able to face, to share our specialty, which is huge, and as we already discussed in Colombia during the ISAPS World Congress, the cultural aspect of our specialty is tremendous. This is really interesting how we can imagine different solutions, but also imagine how we face patients, and we will speak, I guess, for then further on that. But in our consultations, all of us, we have patients coming from all over the world, and really to be able to understand what are the demands of the patients. When you have a patient coming from China or coming from the US or from South America, this is not exactly the same, and you have really to discuss with your colleague to understand how people are clicking when they want to have aesthetic surgery, because as we will say, maybe we have the specialty surgeon which is the most involved in listening to the patient. We have to listen and we have to understand. So I think this is critical nowadays to be involved in international, learning.
Yeah, I think, in general, I understand plastic surgery to be relative to other specialties, a relatively small specialty. So first, there's many more anesthesia providers and anesthesiologists than there are plastic surgeons. But as you said, there's a listening component that's different, because it's more consumer based, because there's more of a taste and a style and uh, a subjective view to success, what a successful surgery looks like. You have to be able to have that exchange of ideas with patients because, a cardiologist doesn't have the same definition of success that an anesthetic or that an aesthetic surgeon does, because you either, if you're a cardiologist, you've either cleared the cardiac problem or you haven't. Uh, but in aesthetic surgery, somebody may like the results, you may think they're good, but the patient may not. And culturally, that's really important. So solving those intercultural differences through an exchange of ideas is, I think, what I heard you saying, because you may be treating a patient that comes from one of your colleagues' countries, and you can learn from your colleague.
Yeah, this is you have to learn how they explain. Then you have to learn how you can translate it, and I would say for yourself. And then how can do it? Is it okay? And even maybe in post-op, how they appreciate it. Some people will say that more directly. Some others will say that differently. So that's really important to be able to understand. In a human being aspect, this is very interesting. This is wonderful actually to be able to be at that level of understanding. We have to.
So you decided many years ago, I think you said almost 30 years ago, to get involved with international societies. And as a member of ISAPS, what do you find to be the most valuable aspect of your memberships? Like, how has ISAPS contributed to your own professional growth and how you've developed as a practitioner? Because in my mind, physicians and medical professionals do a really good job of continuing to learn and continuing to grow in their field throughout the course of their careers. But I don't necessarily think that all patients understand the amount of time that you spend learning and going through courses when you're at an ISAPS meeting or when you're at a regional meeting, that you're actually doing learning that's pretty deep and pretty sophisticated, and it's not just sort of a club.
There are different aspects actually, because when that's true. I wouldn't say that now because for a lot of us, we are explaining to our patients what we are doing, and for instance, I don't use a lot, but with social media, you're able to show what you're doing. I would say in terms of training, but I don't have this. That's true. Some people think maybe we are going to these international meetings to have fun. Of course, it's socially, it's very important. We saw that during COVID time. We had to be together, but in order to discuss. But really, we learn always. Since 30 years, I'm in practice, in private practice. I learn always. When you go to a meeting, you always learn something. Always, and sometimes you have to listen twice, three times the same talk, just and really sometimes you say, okay, I've already listened to this guy, but the second time you listen to the talk, you learn more, and because you want to be in the to get everything from this speaker. So first of all, things are changing a lot, very, very quickly, because a lot of people are working on the topic. And second, you have to listen several times to get the thing. So, going to the meetings, listening to even sometimes the same speaker twice or three times, it's very important. And then you can also, after the talk, have a discussion with others about what has been explained. So you don't learn in once. You have to listen sometimes several times. You have to discuss some points and some results also, and that's true. We have to go to the national meeting, to our national meetings, and then we have to go to our international meetings, and maybe also we have to speak. You have to be, on the podium, on stage. Why? Because when you prepare a talk, you work. You don't want to be stupid, so you have to read the journals, and we have excellent journals internationally, and you have to read it. You have to be at the level, in order to be. So this work is very proactive, and maybe some guys are going to some meetings to also have a social program, but why not before and after? But during the Congress, we most of us were able to share with the industry also, because we have this trade show, these exhibits, and we want to be able to discuss with the industry also of different issues we have with some devices, or some, anything, classes for operations. So it's so important, to share that. Sometimes I'm a little bit sad that some people don't get that. Either, of course, public, and also some colleagues. But most of our colleagues are very happy to go, I would say, first to the National Congress. And I would insist on that, being member of our associations, your scientific associations in our country. This is the first step. And this is very important. And then you see that you have interest also to listen to international speakers from different culture and from different, also, we spoke about that, in Cartagena, in Colombia a few days ago. But speaking with other colleagues from other culture and see what they are doing, for instance, body control in South America, we said that already. The guys are working so hard in that domain, so it's very interesting.
Yeah, I think one of the things that surprised me most, I think it was Istanbul when the ICEPS Congress was there. I think I went to pick up something for my exhibit, and I went to go stop into the uh, the central area where the staff was, and I happened upon the cadaver seminar, or I'm sorry, the live surgery seminars. And, as you mentioned, everyone's been practicing for 15, 20, 30 years. And still, the day before the Congress starts at 6 o'clock in the morning, everyone is filling a theater and watching a live surgery taking place in a local hospital in Istanbul with someone demonstrating a novel technique. And everyone in that room is learning a new technique. And, I think most patients aren't aware that that's what you're doing when you go off to this meeting. And the other part of it that I think is really interesting is I've seen firsthand, even though I've been involved and I've been related to surgery for the last 15 years, I'm a layperson, and so I'm still often very surprised by some of the things I hear. And I consistently hear or see physicians who've gone into a talk, learned about a new procedure or a new technique or a new closure or a piece of equipment that they think might benefit them. And it's been enough at the meeting to pique their interest to where then they take more time out of their schedule to go visit with the speaker at their home, at their own clinic or at their own hospital, and then learn in depth with them, go and do procedures with them and learn that new technique or learn how to use that new piece of equipment so that they can become an expert at it and take it home. So even though they don't do the deep learning at the meeting, there's enough there to draw their interest, enough there to pique their scientific kind of curiosity, and then they can travel to Marbella or San Antonio or El Paso or to someone else's clinic to learn how to do the new technique, which I think is fascinating.
But
Marbella.
so thanks to the technology, we are able to have, for instance, a new format also, which is very interesting. During COVID time, we had this replay with this on-demand things which are available after, which is great because you listen to and then you can re-listen. And also some format with video of surgery. This is wonderful. People can just show some part of the surgery, which is more the critical thing, and so that's something which is a new format in a way. I know. I remember also when I was 30 years ago, 20 years, 30 years ago in the US for the first time. I was really surprised and really, amazed by the fact that even the one who was the most trained, most, experienced, now listen, they're going to courses, you have teaching courses and you have everyone, you have the youngest, the oldest, and everyone is there listening to the guy who is speaking. And yeah, you go back to school. Every year you go back to school. And that's great. That's quite, not for everyone, maybe, of course, but that's humble to just listen to the oldest and also listen to the youngest. And you have some very brilliant people who are really working hard. And sometimes we go to the resident forum or resident presentations because they are in that go deep to in terms of research. So, and also the methodology. So it's well presented usually. It's very very interesting to go to hot topic sessions. So you have a lot of possibilities, and you cannot do everything in one meeting, in one congress. You have several rooms, So you want to go to this one, and you see a colleague, you want to speak with him. So this social aspect, once more, we lost during COVID time. It's so important, not only to be comfortable as a human being, but also to share and to be able to discuss deeply, in the thing.
It's funny you said that sometimes the most experienced doctors were going to listen to some of the youngest doctors talk, because in Cartagena we were speaking with Robert Singer and Fawad Nahai, and I mean those are big names in plastic surgery. For anybody who would listen to the podcast who maybe isn't familiar with the personalities of plastic surgery, I mean those are big names in plastic surgery, and usually at most meetings they're speaking back to back to back all the time. But I'm struck always when I go to speak to Fawad and he's running through the hall and he said, I really want to go hear this lecture on rhinoplasty. And he's probably taught more lectures on rhinoplasty than anyone in the world, but he's eager to go learn from somebody who is speaking from their own clinic and their own perspective just as much as he is to teach.
Yeah, true. Yeah, and also introducing the youngest to the most experienced surgeon. That's great for them. Robert Singer and Fred it's easy to speak with them, and everyone is happy to just to share with these masters in order to just to be able to revisit sometimes after, and we had an idea, for instance, in France was to go to visit some masters and with the youngest. So, before or after Congress,
Like a
and
salon
going
almost.
together like a small, delegation. Yeah. And being able to,
Right.
how do you say that in English, break the ice, or, and that's wonderful, and it creates also something very. This is actually the DNA of surgery. This companionage, fellowship, which is really this work you cannot learn or work as a surgeon without being together. Like the one with the mentor and the one with the trainee, and all together. We had to work on microsurgery in the past when we were resident, and of course, it's a teamwork. It's a team learning process also.
Yeah, well, I think you said to me in Cartagena too, these masters, they don't want to leave the knowledge that they've built. They don't want to take that with them. They want to leave it as sort of a gift to the science and a gift to the specialty as they move on from practice. As they start to slow down their practice, it would be a tragedy to lose that knowledge.
That's the symbol and the meaning of books. Now it's not only books, it's also of course video, other media, but books in order just to put what someone has experienced during 30 years or 40 years of practice, and you have different way to make it. You can speak about, you can read, and of course write and read. You can watch a video, but multiplicate all these tools in order to leave something.
Right.
That's a sense of humanity. I wouldn't like to be too much in philosophy, but I like it. So human beings, this is the way we process, thanks to our to the words, to the book, and then oral at first, and then to the book, and then now with the social, with this new media.
So, ICEPS clearly produces a great environment and a great forum for ice breaking and knowledge sharing and communication.
Yes, during COVID time, ISAPS produced probably the most interesting bank in video. We had a lot immediately. We made a lot of webinars, and they are still available on the platform of ISAPS, and they were very interesting, very interesting. So it was well done, and it was really the beginning of a lot of webinars available, with the best surgeons. So it was great.
So it provides a great forum, but can you discuss maybe some of the key programs or initiatives that ICEPS offer that you think are just incredibly impactful for surgeons as they try to distinguish their practices from people who are not participating in ICEPS? What are the actual deliverable programs that ICEPS has that you really think are standout?
So there are numerous, as we said. Of course, we have the congresses, we have these webinars available. I think for this proposal, for Quaday, by Quaday, it shows, because this patient safety, diamond that I have that on my jacket. This is something, a concept which is developed by Fouad Nahai and others, and Robert and so Singer. So these four sides, so important for patient safety. Patient safety, this is the main goal, for our work and ISAPS. And you have the patient, you have the surgeon, you have the procedure, and you have the facilities. You have these four aspects of patient safety. And ISAPS is working on all of them. And the fact that we developed this program with Quaday was really more focused on the facilities. That's it. That was the thing which was missing, actually, in this development. Of course, the procedure. We worked on the procedure with ISAP since the beginning. The patient, of course, we have to consider the patient, how the patient is, and we have to just think about that when you just decide for surgery or for no surgery, because it's also nice to be able to say no. Of course, the surgeon has to be considered, I would say. We can speak about also soft skills. But finally, facilities is also something which is basic, critical, because if you have no good facilities, you will have good facilities, very well, maintained. You cannot reach actually the excellence. You will have some problem. You have to be able to react in case of any emergency. You have to train your team. It can be a weakness, and the level of your practice is at the level of the weakest aspect. So either surgeon, patient, procedure, facilities. The weakest is actually the level you have.
Yeah, I know when we were thinking through the global accreditation program, obviously our accreditation program has existed since 1980. But as we really looked at the fit of our collaboration, just the amount of research, the amount of effort that ICEPS puts into making sure the surgeon is at the top of their game, it's only right to then fill out everything around the surgeon. So their team and the building and the equipment and the drugs and their protocols and all those things really is the way to make the surgeon operate at their best capacity. Because in a small clinic, it's difficult to be a good surgeon and a good leader and keep your eye on all those details at the same time. There's not enough hours in the day to do that.
you have to be aware of something sometimes you don't know, and the team. I'm working for insurance in France and in charge of plastic surgery for one of the most important malpractice insurance. And we have seen some colleagues, maybe sometimes the team is not trained or is reduced. And when you have a patient calling to your office because there is an issue, you know, you have to have a team which is able to listen and sometimes to fix or to ask you. You have to be, of course, connected to your team always. There's a lot of possibilities. And then in order to answer immediately, if it's important. So this is not nothing. It takes time to prepare that, and you cannot work saying, okay, we'll see. No. Tomorrow morning, maybe there will be an issue, and tomorrow morning you need to have a team. When you go to the meetings, you need to have a team at home in order to be able to fix, what is the most important to it. You need also to develop nice relationships with your colleagues. And once more, we go to the point of associations. We go to the point, or you cannot work alone in an office without any connection with your colleagues in your clinic, the colleagues in your area. You have some local association, and you have to be involved in association. And then colleague in France, because sometimes you need colleague more experience in something. And then why not international? And we have now this WhatsApp group. Sometimes can be useful, very useful. I would like to insist on a point. People are not involved in associations sometimes, and this is something we discussed in Colombia together. I like this example of golf. Golf club. You have two options. Either you go to the golf club just to play golf and you don't pay any fees to the association, to this club. Just pay your fees for your few hours on the course, or you have to be involved in the club because they need money to improve everything. So it's a question of mindset. Either you feel that you need to contribute to something which is bigger than you, or you just a consumer, and that's not okay. Of course you can do what you want. You know, you cannot be a consumer for everything without giving a little bit either money or energy or time or everything. So you have to be involved in associations, professional associations, in order to share, in order to exchange, in order to go further, to go forward, and to improve yourself and your practice.
Well, yeah, and I think one of the reasons or one of the ways that which ISAPs and associations, I think, tries to contribute and tries to pay back and tries to move forward as a specialty is through research and innovation. Can you speak to the way ISAPS actually supports research and how they do that, and also with that, how use ISAPS sort of advocates or to undertakes advocacy in various countries to make sure that regulators and governments and ministries are aware of the advancements and what should be happening in plastic surgery facilities around the world.
Things are improving always. So even in our association, even in ISAPS, we had this global alliance, meeting a few days ago in Cartagena, and then there was also the national secretaries meeting, and it was also brainstorming in order to find new way to improve that. And the basic for improving is, of course, I was co-chair of the patient safety committee for just the past term, and we were with the board of ISAPS. We produced recommendations for different, surgeries, and also for to prevention of DVT, to sometimes also for these fake injectors, the complications of injections, fillers. So we need to promote these recommendations or these these papers in order to help the surgeons, national secretaries, national societies to be able to have more data to go to the bodies, the government, the Ministry of Health, and just to show what's going on. Sometimes you have more practice in the country. We can take this example of BBL, for instance. The Batting President surgery, and of course, there are a lot. There was a big practice in South America at the time, and we saw some complications. And then it was brought to ISAPS. People work on that in order to improve. Some countries stopped this surgery for a while, just in order to be sure that it's safe. And then people worked. A lot of colleagues worked on that, and then they come back to the other ones. No, UK had suspended for a while this surgery. I think now they are back. It's okay. It's allowed, but we have more information, so we're able to explain that ISAP is great for that because you can really share. Some countries go faster on some surgeries for different reasons, and so this is wonderful to be able to give new recommendations. And this patient safety committee was really very, very, very active. And Montserrat from Bonafonte was the chair. And I think we worked a lot on different, even for fentanyl, for instance, the people using fentanyl too much in North America. So that's a lot of accidents on that. So we say, okay, be careful with that. So we learn from the other ones because the waves are coming sometimes from Europe, from Asia, for instance, in France, we have a textured implant that have been banned. That's not okay. We use textured implants sometimes for breast reconstruction or for tuberous breast, and we are not able to use anatomical implant with textures, with gel, which is very cohesive. Why? Just because they are afraid. The French government is afraid. That doesn't make sense. All over the world, they're using still this implant, and it's okay. It's very useful for in different situations. So sometimes our governments are really they don't take the right decision just because they're afraid. What about fear? So they're afraid and they stop the practice and say, "We're sorry, but just close to us. They use it. It's great." And then we can come back. It takes years, but that's science. That's basically for our association. It's only about data and science, not about fear, not about we think, no, this is serious.
Yeah, I think in Cartagena we were discussing this topic a little bit, and one of the things we both were kind of going back to was history and anecdotes, and sometimes there's one story and there's one tragedy, and the government shifts to address that specific tragedy. And when we talk about even what Quad A does in terms of accreditation, we're trying to approach things from a very flat, scientific. Our committee is all medical professionals with, combined 1,000 years of practice experience. And so we try to deal with things on a very flat kind of scientific wavelength, whereas the government's going to be reactionary to a news event or a tragedy. And you mentioned the textured implants as being an example. And in the US, we had a similar issue where succinylcholine is a effective rescue drug for any kind of airway issue. But because of the way the rules are written in many states, if you use succinylcholine, you also need all of the drugs to treat malignant hyperthermia, such as Dantrium, and things like that. But because of that requirement, because of the prohibitive cost that can be for some smaller clinics, in some ways, many clinics just stopped carrying succinylcholine, which then made them incapable of dealing with an airway problem, because they would just then call 911 and they would rely on the emergency services and the ambulances to come, and the ambulance would bring succinylcholine. They would administer it to the patient, and ambulances, just because the laws are very different, are not required to carry all of these malignant hypothermia drugs. So the rule was poorly crafted to protect patients, but in its effect, it actually wound up, exposing patients more. So approaching things with a more scientific and kind of impartial method can allow all of us to kind of learn more, as you said, and that knowledge sharing across borders that association breeds. Your point was textured implants. Mine in the U.S. was uh, Bantrim and DVT. Impartial, but I see it too. I see it too in small countries as well. In small countries where there's not as much volume, maybe there are only 2 or 3 cases a year, and the government just doesn't know what to do, so they just put a stop to it. And then they can look at a larger country like France or like Germany or like Brazil and get a lot of data out of there that they can then apply and use it to justify to the government.
But I would say no country has the perfect, has all the best decisions. We can be sure. For instance, in France, we're not able to use PRP just for the past history of France in health. And so, but we have to correct that. And we are working also on standardizations of in Europe. And even in Europe, we have to share at different continents. They have to share, and then at the world level, of course, it's also another point. And people are different also. So that's another point also, about the pathologies are not the same in different countries, and the risks are not exactly the same in different countries. That's also something interesting. But and we have patience because you have also tourism. So our work is huge, but if we don't share, we lose time, and if we lose time, we can have some complications, and we can have issues with patients just because we are not reading, we are not listening, we are not visiting our colleagues, we are not able to present our complications to the other ones. It's important for the patients.
I think, that's a really important point that is sometimes missed. I mean, it's not just all about the good stories. Complications are probably more important to learn from than successes. It's commonly said that you learn more from failure than success, and I don't know that we always think about that in terms of medicine. But when somebody has a poor outcome or a complication, and they share that at a meeting, that's an incredible amount of vulnerability that they're sharing with colleagues who they want to keep a good reputation in front of. But that story, their quote failure, their poor outcome, is so incredibly important for hundreds of patients.
I have to say, Tom, in our Western associations in France, on the west part of France, we share that all the afternoon we show our complications only. So okay, and we know that we did also substep. We made a webinars about complications, for instance, with breast implants. It was very interesting, and it's you have to present that, and actually surgeons are very interested in these webinars or sessions because this is, and even if you congress and the main thing is about complications, we learn a lot. We learn a lot, and you have to be able to present that. Everyone has complications, and it's, I would say, also the new techniques. That's nice to see. You listen, new techniques. Be careful. New techniques. You can also know what are the complications possible. Sometimes with new techniques, you don't know exactly what are the complications. So don't jump on the techniques. Just carefully, just you have to learn. There's a learning curve for everything. So when you come back from Congress, you have to also to take your time to be sure that your new technique is okay, well understood, and in order to practice well. So that's also it's time.
Well, along the same kind of thought process is your earlier point about sharing knowledge and sharing solutions to problems, and along the lines of sharing your complications. I'm always struck. I think Claude has been working internationally since 2004. I've probably given presentations in 20 countries. I've done assessments in more countries. And what I constantly hear from doctors is, oh, I have this problem, or this is unique, or this is a challenge. And most often those challenges are the same challenges I heard in the other 19 countries, or those problems are not unique. They're very common. and with ISAPs, with continental groups, with Quad A as an international organization, we have the ability to let physicians and their practices and their facilities know that they are not alone, that they are not the only person struggling with this. And here are the ways that other people have solved this problem in the past. And I think one, it's psychologically helpful for physicians who are supposed to, who there's a notion
Yes.
that they know kind of everything that's happening all the time. And so they don't necessarily always want to admit when they don't, but also as a way to help them to build that knowledge base, because no one can know everything.
And don't forget, when we were residents, the the frame we had was to be a team together, sharing, presenting, discussing non-stop every day, sometimes during the night. And so as soon as you're in private practice, if you're alone in your own office, you cannot improve yourself. You cannot. You need to share. You need to have, and it's a need. Everyone is most of the people are as a surgeon. This is in our DNA once more. It's a fellowship. It's really a work. It's like for cooking. You have a chef. And this is a team, and you are trained because you are non-stop close to someone who is able to train you and to check that you do well, and you can ask questions. So as soon as you're in private, you don't have this possibility to be non-stop able to ask questions or to have a master who is just showing how you should do, or if you do badly, you can have sometimes it's a can be a difficult time, but that's the way sometimes you learn. And as soon as you have a complication, the way you manage that. So it's a non-stop training. After decades of practice, you still learn every day. Every day, every meeting, everything you read, you can learn. So it's a proactive. It's very proactive.
Yeah. And I also just think it's really important to know that you're not the only one struggling with something. If you think you're the only one struggling with something, it's hard to admit that you're struggling with it. But if you know that everyone around the world is struggling with something, it's much easier to say, how do I fix this? Has anybody fixed this yet? I think
And I learned in insurance malpractice a lot, and for instance, sometimes the surgeon alone is not able in digestive, for instance. You need to have a colleague to say, no, you have to go back to the surgery right now. Not maybe, no, it's not a mistake, it's okay. And then 2 or 3 days after, patient dies. So, no, it's now because it's special. We are human beings. Our reptilian brain, sometimes, we just in a different mood. So you need another one, which is, I would say, more in the back, being able to say, no, at the same level of practice, just,
conscious.
go now. Just it's your Yeah, because it's your patient, so you don't have exactly the same behavior in front of your patients. You need a colleague, your friend, just close to you, or sometimes a call. It's available also a call for this malpractice insurance that you can call for an infection. What I should do, because you need someone to help you. So for 24 hours, 7 days, you have someone on the phone. So that's great.
So
That's great.
we really talked a lot about the research and the education. So what advice would you give a young plastic surgeon who's just finishing residency, perhaps, and what would you give them in terms of advice on how to take their career trajectory with becoming, involved in associations, specifically ISAPs, and how can they maximize their membership in any organization to kind of maximize their career?
So ISAPs and also, for instance, in France, SoftSep, we developed a lot in order to have the residents, member. They don't have to pay. Usually, they are members for nothing, for free, and as soon as they are there, they are so happy to find people just to teach them, and especially aesthetic, because aesthetic it's not the thing which is the most trained in the hospital, in the public hospital. So you need very quickly to have some references, some people you can work with. So I would say very quickly, as resident, as in plastic surgery, it's nice to be also in these associations, which invite you to be there for nothing. So most of them, they understand that quickly. Some they don't for different reasons, but it's not a question of money because you're invited. I remember once more in ISAP's meeting, we had the tables with the residents, and we just were meeting people and just explaining how they could imagine their the start of their practice, about new devices, this energy based device. You have to buy one or not, it's expensive. It's very expensive. So don't jump on something which is not needed. Otherwise, you will be in a kind of trap sometimes. So you need a lot of information, since the beginning, really at the beginning, the first time. And as soon as the earlier you are, member of an association, national, international, the more effective you will be, and of course, the more comfortable you will be, and the more protected and efficient with patients. So you don't have to, you shouldn't wait for being out in private. You should be for the residents immediately, and most of the professors, they just push their residents to be involved in these associations, and we create in these associations place for. First of all, it's important for patient safety. Second, it's important to show to these people how important is it to be member, to be involved in. We need also the ones after. We're going to leave the place. We're going to leave the position. We need the other ones then. So we need them to be member, then to be the committee chair, and then in the board. That's also the last point of any practice, any activity of human beings. Transmission. Think early about that.
Right. And I also think, it's hard as you try to build a practice or as you try to build a career to do something that you see as a side. And I think if I were speaking to a young professional of any profession, it would be to take that time to consider that part, association, leadership, all of those things to be part of your career, not something outside of it. Because it's easy to say, well, I don't have time because I have to do more surgeries. It's okay sometimes to take a percentage of your time and get into the association and consider that part of your profession as well.
This is a part of of course, of your practice. Time to be able to share with the other one. Also, time to manage your business. Also, take time to discuss with your team. Take time to improve the processes. You need to have time, and that is not only about surgery. It doesn't make sense. You need to protect time. Also, time for yourself. And this is about soft skills, to be able to listen to patients. It's not. It takes time. It takes energy. So you need to feel great in order to listen well, in order to give the best proposal in terms of surgery or no surgery to the patient. Say no and explain it. So it takes time, and your team too. Team has to have time to explain to the patient why not, or why yes, and how yes. Also, explain everything, inform consent, what are the possible complications. It takes time. You need to be aware, and you need to be patient. You need also to be able to explain. Another issue for the language when it's tourism. Okay, so and ISAPS faced tourism surgery, early, and Quade was on that point too. And this surgery is special, but it goes in both ways, You can go to have sometimes a surgery for different reasons in a country where it's less expensive, where you have sometimes a very good surgeon, excellent surgeons. And we have also in some countries where we are supposed to have maybe more sophisticated facilities. We need also to be able to consider this patient coming to our country. So it's not only in one side, it's in both ways. And tourism is not a bad thing. This is something which is a little bit more difficult. And ISAPS made recommendations for that. In times like, you need sometimes ultrasound. just to check no DVT, no echo, the echo phenomenon you can have in aircraft, after a long trip. So these things you have to understand that I'm not going back to your country too early. I remember we have a very good webinar with the patient safety committee with our friend from Colombia, and just explaining that they manage very well. They just explain to the patient, if you come to a surgery for body contouring especially, you need to stay in the country for a while just to be sure that you're ready to come back home. So that's a serious tourism, surgery, and so that's not impossible. It can be done very well, but it needs also to be understood and to be prepared in a right way.
Right. I couldn't agree more. I think that there's nothing inherently wrong with medical travel and medical tourism. Just needs to be handled very responsibly and very clearly with patients who don't always recognize, because of how unique aesthetic surgery is, that I think sometimes, we talked about it before, sometimes in the race to make it more commercial and to make it more marketable and to make it more approachable to our patients, and sometimes it's been made less invasive and simpler, and patients don't always treat it as severely and as seriously as they need to. And we need to continue to inform patients that this is healthcare, and it's not just like going to do your nails or doing your hair or makeup.
You don't go to the supermarket. You can do a lot, but of course, if you come from far away, there are some rules you have to respect, and that's it. And it's important. ISAPS is in the right place for that, and Quade is also in the right partner in that with ISAPS in order to improve that. So, to be sure that the facilities are okay, the recommendations, consider the procedure, and so on. So procedure adapted to this kind of practice. Yes, it's a diamond. So.
Yeah, to that point, I think, I'd be remiss, and I know we want to wrap up where I don't want to take too much of your time, but I'd be remiss if I didn't ask you to kind of close up with your thoughts on kind of maybe describing a little bit of what the Global Accreditation Initiative is and how it can really benefit patients and plastic surgeons.
Yeah. So this global accreditation, this is what we are speaking about. This is the fact that we are at the end able to propose to our members something which is really showing that you are at the level of, the most the safest practice you can imagine, because you are aware of different, aspects. And this is the goal, ISAPS, patient safety once more.
Yeah, I think it's so powerful to know that, again, we're sort of taking the physician and all the knowledge that ISAPS provides and all this technical training and scientific lectures and putting them in the middle of a big jigsaw puzzle. And then the global accreditation kind of fills in everything around it. And it goes from infection control practices to protocols. And one of the things I'm very aware to always point out, especially to our global audience, is that this isn't an American approach or a British approach or a French approach or a Mexican approach. This is science. And it's just to say, here's how you rescue an airway, and here's how you rescue someone. And if you're accredited, no matter where in the world you are, if it's Cartagena, if it's Dubai, if it's Paris, wherever, if you're accredited, you're meeting that same standard. And no matter where you're treating that patient who's flown across the world or who's a local, the facility is capable of working at the top level. And now you have a surgeon that is trained and is continuing to be trained at the top level.
Yeah, that's also something. Yeah, we are working on that also. Yeah, just to be able to confirm that the level of the surgeon is is known as good enough or not good enough. But we have to work on all the faces of the diamond, on the sides.
I don't want to take up too much more of your time. I know it's your very busy time. You've just returned from Cartagena, so I'll close by just saying thank you for joining us on this enlightening episode of Quade Now podcast. We're deeply grateful to Dr. Michel Rouif for sharing his vast expertise and insights in the world of plastic, reconstructive, and aesthetic surgery. His contributions to the field and dedication to advancing medical practice have provided us with his invaluable perspectives. We hope you found today's discussion as informative and inspiring as we did. If you have any questions or would like to learn more about Dr. Rouif's work, be sure to check out the links in our show notes. Don't forget to subscribe to the Quad A Now podcast for more conversations with leading experts in medicine. Until next time, stay curious and keep exploring advancements in aesthetic and reconstructive surgery. Thank you for listening, and we'll see you on the next episode. And if you are a patient, make sure that your physician is a member of society and make sure that they are in an accredited clinic. Thank you.
That's a wrap on another enlightening episode of Quad A Now, a global accreditation podcast. Stay tuned for more captivating discussions with leaders who are shaping the landscape of quality and patient safety. Remember, patients first, always. That's a wrap on another enlightening episode of Quad A Now, a global accreditation podcast. Stay tuned for more captivating discussions with leaders who are shaping the landscape of quality and patient safety. Remember, patients first, always.